Hey everyone, my name is Ashley Cooper. Today I'll be presenting about rabies. The rabies virus belongs to a group of viruses called lysoviruses. It's a tiny virus with a bullet-like shape. It contains RNA, which is genetic material. If you look into the right hand, on the right hand side, you'll see a picture of the rabies virus with all of its proteins. You can see the envelope, the RNA, which is the yellow. And if you look at the G protein, that is the most important part about the rabies virus because that is actually what attaches itself um, to the host. The virus spreads through saliva of infected animals, mainly either through a bite or a scratch. Common carriers of rabies, or what we call reservoirs, include dogs, bats, raccoons, skunks, and foxes. So, a little history about rabies. I'll talk about ancient history and then more recent history. Um, it goes back thousands of years to around 2300 BC. There were references to rabies like diseases in ancient Mesopotamian texts. During the Greek and Roman eras, Aristotle had described rabies as the mad dog disease, which I think is something that we associate today. When we see dogs, we automatically think, do they have their rabies shots? Um, there was even a possibility that rabies was mentioned in the Old Testament. In medieval times, people used some interesting practices to deal with rabies. One of the common things that they would do was cauterize, which is basically like burning the skin or the wound after the animal had bit its host to prevent the disease. They also tried herbal remedies like garlic and warm wood to treat what they call the madness. In more recent history, in 1885, Louis Pasteur created the first rabies vaccine by weakening the virus using rabbit spinal cords. A few years later, in the 1890s, Emil von Behring, he studied how the immune system reacted to rabies. And then about 18 years later, Paul Remenlinger and Aldelchi Nagra confirmed that rabies was caused by a virus. Nagra also discovered the Nagra bodies, which you will see commonly associated with rabies. They are tiny structures in the infected brain cells that help us diagnose what rabies is. In the 1920s and 1930s, scientists also learned how to grow the virus in labs, which made it very much easier to study and actually diagnose the disease. So, a little more about the history of rabies. We'll talk about ancient history and more recent history. So, rabies actually goes back to around 2300 BCE. There were references to rabies like diseases in ancient Mesopotamian texts. During the Greek and Roman eras, Aristotle had described rabies as a mad dog disease, which I think today we still associate rabies with dogs because quite commonly I feel like that's the main thing that we see with rabies today, people getting bit by dogs who are not vaccinated. There's even a possibility that the rabies was mentioned in the Old Testament. In medieval times, people like to use some interesting practices to deal with rabies. One of the common methods that they used was something called cauterizing, which is basically burning the wound after an animal bite to prevent the disease from spreading. They also tried herbal remedies like garlic, wormwood, to treat what they call the madness. In 1885, Louis Pasteur created the first rabies vaccine by weakening the virus using rabbit spinal cords. A few years later, in the 1890s, Emil Behring studied how the immune system reacts to rabies. In 1903, Paul Remlinger and Aldechi Nagra confirmed that the rabies was caused by a virus. Nagra also discovered Nagra bodies, which are the tiny structures that you can see under a microscope into the infected brain cells that help us diagnose rabies today. In the 1920s and the 1930s, scientists also learned how to grow the rabies virus in labs, which made it way more easy to study and diagnose the disease. So, to get more in depth about the signs and symptoms of the rabies virus, it is an acute viral encephalitis, which is nearly fatal once symptoms generally appear. I work as a nurse in the emergency department, and I will say that typically we don't see patients that who are actually symptomatic. They generally will come in once they are bitten by an animal. So within, I'll say, minutes to hours of the initial bite, they'll come in to be treated, and generally they are never symptomatic. So there's an incubation period, which is typically 1 to 3 months, but it can range from weeks to years, depending on the severity of the wound, the exposure, site proximity to the central nervous system, and the viral load. Um, Most people, I feel like, when they do get bit by an animal, their first instinct is to go to the emergency room to be tested for rabies. The early symptoms is called the prodromal phase, which generally patients will come in with fevers, malaise, which means they're just generally just overall tired, headache, nausea, vomiting. They also may have pain or paresthesia, which is like tingling at the site of the bite. Um, the next phase is the neurological phase, which this is advanced symptoms, and this is when the virus is really like headed into the wrong direction. Um, a first symptom would be hydrophobia, which the patients will have fears of water due to painful spasms in their throat muscles. Aerophobia, which is fear of air drafts coming to the patient that causes them to have painful spasms. We also may see a patient that's agitated, having hallucinations and confusion. And in like really bad cases, they will have partial or complete paralysis because the virus is basically taking over their central nervous system. The terminal phase is, I mean, pretty much, the last phase before they die. They'll go into more multi-organ failure, which will then cause respiratory or cardiac arrest, and then um, they will pass. So, just a quick overview of the pathophysiology of the virus before we get more in depth about it from a microbiology standpoint. So, the virus enters the body through saliva of the infected animal. The rabies virus then binds to the receptors on the peripheral nerves. The virus travels retrograde um, to the dorsal root ganglia and spinal cord. It then disseminates to the brain where it replicates and spreads to other tissues, and that is basically when we go into those late stages that we just talked about. So let's talk about how the pathogen actually causes the disease from a microbiology standpoint. So the rabies virus is a single-stranded RNA virus that is shaped like a bullet. It is negative sense. This means that it can't directly make proteins that it needs. So it actually fixes itself and brings it its own special tool, which is called the RNA polymerase that converts the RNA into a usable form. It's kind of like a readable instruction manual. Once the virus gets inside the host cells, it releases RNA and it starts taking over the cell's machinery. It uses the cell to make copies of its genetic material and to produce the proteins it needs to build more viruses. These proteins, including the ones that form the virus's outer shell, all come together with a new RNA that was created to create new virus particles. Um, the particles leave the cell and spread the infection into other cells. The virus is especially good at affecting the nerve cells because of that special protein that we talked about in the first slide called the protein G. Um, Basically, it helps attach the virus to neurons. Once it reaches the nervous system, it spreads pretty quickly, causing all of those symptoms that we just discussed. So, how do we identify rabies in the laboratory? If you look over to the picture on the right side, that is a picture of the rabies virus. One of the distinct characteristics that it has that we just discussed was how it is shaped like a bullet. There are several different techniques that can be used to identify rabies. The first one is the direct fluorescent antibody test, which is DFAT. It's the gold standard. It detects rabies antigens in tissues like brain samples. The next one is the RT-PCR. It's another method that works for viral RNA in samples like saliva, spinal fluid, or skin biopsies. The third one is histopathology, which involves searching for specific structures called the nagrobodies in the brain cells, which we previously discussed in the slides before. There also are serological tests that detect antibodies in the blood or the spinal fluid and can confirm rabies exposure. The rabies virus can't grow on artificial media, but it can be propagated in lab animals or cell cultures. Common samples used for testing include saliva, um, CSF, which is cerebral spinal fluid that can be drawn from your lower back, and skin biopsies. They typically get those from the neck area, or they will take a biopsy of brain tissue after death. So, how is it treated? Like I told you guys before, I work in the emergency department. So, we see this a lot. People come in to the emergency department because they've been bitten by an animal um, and they're afraid, that the animal may or may not have rabies. So, generally, we'll just go ahead and provide them treatment and they'll actually come back to the emergency department um, in 7 and then 14 days. So the post-exposure prophylaxis, which is several steps to prevent the development of rabies, it involves first we wash the wound thoroughly with soap and water to kind of reduce the viral load that may be spreading. Next, we administer something called a rabies immunoglobulin, which is RIG, and it's provided to give passive immunity by neutralizing the virus at the site of the exposure. Generally, the injections are given like subcutaneously around the bite by a provider, and then the nurse will follow that with an intramuscular shot. Generally, they'll get 4 doses over 14 days. But I think that was standard. But now, new evidence-based practice, I think that they just come back at the fourth and seventh and 14th day. So technically, I guess that would be 4 doses if you include the first one. But once the clinical symptoms that we talked about earlier appear, generally there's no effective treatment. Once rabies gets to your central nervous system, that's pretty much it. In advanced cases, generally the patient they'll receive supportive care just to kind of help them stay comfortable. They'll go to the ICU. Generally, they'll be intubated and put on a ventilator. Um, at one point in time, there was something called a Milky Way protocol, which involved placing the patients into, induced comas and administering antiviral therapy, but it was found that it was rarely effective and the patient still died. To prevent rabies, vaccination of domestic animals and at risk humans, such as veterinarians, is very essential. Um, They also have public health campaigns that also focus on controlling rabies in stray animal populations. So, lastly, here are some interesting facts about rabies. So, rabies is one of the deadliest diseases with a 99.9% fatality rate if it is left untreated. It is 100% preventable with timely post exposure prophylaxis, which is basically coming to the emergency department right after a bite. In rare cases, the incubation period for rabies can last up to several years, which we discussed in an earlier slide. I found that was pretty cool. In the United States, bats are the primary reservoir for the viruses, but globally, dogs are the leading cause that accounts for over 99% of the rabies virus. Despite it being preventable, it is often considered a neglected disease in low income countries. Each year, about 59,000 people die from rabies, with more than 95% of those deaths occurring in Africa and Asia. So I guess it's a good thing that it doesn't occur here in the United States as much. India also reports the highest number of human rabies deaths annually, with around 20,000 cases. And rabies is actually one of the oldest diseases known to humankind. I hope you guys took something from this presentation. If you didn't take a lot or won't remember much, just remember to get your animals vaccinated with the rabies vaccine. And if you encounter an animal bite with any of those reservoirs that we spoke about in the earlier slides, be sure to get to your nearest emergency department as soon as the bite happens so you can have good outcomes.